My name is Erin Hoben, and I work for the Children's Defense Fund. So we try to make sure that every child in New York has access to affordable and quality health care so that they can get a healthy start in life. So for us, the Affordable Care Act is hugely beneficial for children. So already in New York State, as Jasmine mentioned, we do have the dependent coverage. We have a prohibition on lifetime limits, the Medicaid expansion, which was just happened last fall, the expansion of preventive services without cost sharing, school-based health centers, maintenance of effort, and the pre-existing conditions, which have all been affected by the ACA. So dependent coverage, adults up to age 26 can be on their parents' insurance, which is hugely important right now with kids graduating college and not able to access jobs. If they do access jobs, a lot of times they don't have employer-based coverage. So it's nice to say, hey mom, hey dad, can I get back on your plan? And thus far, this has benefited over 150,000 people in New York. We also have the prohibition on lifetime limits. So the law bans insurance companies from imposing lifetime limits on coverage. And as a result, 1,609,000 children have benefited from this. So almost 2 million children. And then again, like Jasmine said, it restricts the use of annual limits and bans them entirely starting in 2014. The Medicaid expansion. So under the Affordable Care Act, people are going to be able to access Medicaid between or up to 138% of the federal poverty level. So New York, being ahead of the game, decided to go ahead and start that in November. And this will be helpful for families that had stair-step eligibility before, where one child was on CHIP, one child was on Medicaid based only on their age. So now in a family, all children are going to be on the same plan. So everyone's going to be on Medicaid, which means you can take your kids to the same doctor. You don't have to take one to one doctor, another one to a different one. And an estimated 70,000 children are going to enroll onto Medicaid because of this provision. The expansion of preventive services without cost sharing. The ACA requires many insurance plans to provide coverage for and eliminate cost sharing on certain preventive measures. And I remember Sherry was talking about how this is prohibitive, and it's also prohibitive for children. You know, if a mom sees that she has to pay $10 or $15 for her child to get preventive care, it's not something that they necessarily need. They're not going to go and do it. And already almost 1 million children have benefited from this. So just over 800,000 children in New York have benefited from this provision. School-based health centers. These are really important in New York, especially for adolescents. We're finding that a lot of adolescents aren't necessarily accessing care. You know, they're very nervous because they want to talk to their doctor about sexual intercourse, and they don't feel comfortable doing that, thinking that their parents are going to know. So the school-based centers, in their school, they can just go to somebody, and it's all confidential. And the ACA has already given $12 million to clinics in New York State for this. The maintenance of effort. Under the ACA, states are not allowed to cut back their Medicaid and CHIP programs beyond the levels they were when the law was signed. So on March 23rd, 2010, however New York was, they can't reduce that at all. And the eligibility levels have to stay for children in Medicaid and CHIP through September 30th, 2019. And if a state does violate this, they are at risk of losing all their federal matching funds. So they have to abide by it. And the states will also are insured to receive 2 more years of CHIP funding. For pre-existing conditions, again, insurance companies can no longer deny somebody coverage for a pre-existing condition. And in New York, 260,700 children have benefited from this. So that's what we've already got in New York. And there's a lot of things still coming down, which is why we have to make sure that this stays. Children are going to be mandated to have health insurance. There's going to be foster care children are going to be able to have more coverage. There's going to be child-specific services. There's the creation of the Center for Medicare and Medicaid Innovation. It's going to be more affordable. There's a childhood obesity demonstration project. There's a child-only coverage option in the exchange. And then there's going to be an oral health benefit. So for foster care children, in 1999, New York expanded Medicaid to allow them to stay on until the age of 21. Under the ACA, they can stay on until the age of 26, which is excellent because foster care children are, you know, more at risk for mental health problems, more at risk for substance abuse problems, and they need that assistance. Child-specific services. All health plans in the exchange are going to be required to have an essential health benefit package. And while we haven't defined this, there are 10 items that the ACA requires each benefit package to have, and one of those is very specific preventive care for children. The creation of the Center for Medicaid and Medicaid Innovation. They're going to start looking into methods which are expected to improve the quality of care and reduce the rate of growth in healthcare costs for Medicare, Medicaid, and CHIP. So that's something that the ACA has created a provision for. And more affordability. And we all know that the exchange and all the health plans there are going to be more affordable. So in 2014, the law will provide refundable and advanceable premium credits. Families with incomes between 133 and 400% of the federal poverty level will be eligible, and they'll all be accessible on the exchange. The Childhood Obesity Demonstration Project. The ACA gave $25 million to the Centers for Disease Control to look into why children are obese and what can we do to prevent this, to help them prevent chronic disease. And they're focusing on children ages 2 to 12 that are already enrolled in CHIP. The child-only coverage option. This is really important because we're going to have mixed households. So you're going to have a child that's living with their grandparents, and for the purposes of the ACA, they're not going to be a tax household. So for this, if somebody wants to enroll their child in, they can go onto the exchange and they're able to buy just a child-only coverage. And then lastly, oral health. The ACA creates an oral health prevention campaign, dental caries disease management, school-based dental sealant programs, and cooperative agreements to improve infrastructure and surveillance systems. So that's what I have on what's happening with ACA and children.
Excellent. Thank you. Thank you very, very much.